Hello and welcome. If you're turning 65 or are already enrolled in Medicare, there's something very important you need to understand. Medicare Part D, your prescription drug coverage. As a trusted insurance advisor who has worked with seniors across the country for decades, I've seen firsthand how confusing and costly this part of Medicare can be, especially when changes happen year after year. Now, as we look ahead to 2025, there are critical updates to Medicare Part D that you need to know. From monthly premiums to changes in the coverage gap, also known as the donut hole, these shifts could significantly impact how much you pay for your medications. But don't worry. In this video, I'll break it all down for you, clearly, step by step, so you can protect both your health and your wallet. Whether you're enrolling for the first time or reviewing your current plan, my goal is simple: to help you make smart, confident choices that lead to a healthier, safer, and more secure retirement. So stay with me, because right after this, we're going to explore exactly how Medicare Part D works in 2025 and what every senior needs to watch out for this year. You don't want to miss it. If you find this information helpful, please take a moment to like this video and share it with someone you care about. Your support helps more seniors get the clear guidance they deserve. What is Medicare Part D? If you're approaching 65 or already enrolled in Medicare, it's important to understand what Medicare Part D actually is. Part D is your prescription drug coverage under Medicare. It's not automatic, and it's not built into original Medicare. Instead, it's provided by private insurance companies that are approved by Medicare. You can get Part D in one of two ways: as a standalone plan, which pairs with original Medicare, or bundled within a Medicare Advantage, Part C, plan that includes drug coverage. It's designed to help protect you from the high costs of medications, especially as prescriptions become more essential with age. But with multiple plan options, varying drug lists, and different costs, making the right choice takes careful review. Stay tuned. Next, we'll go over the key enrollment periods and deadlines that could save you from costly penalties. Enrollment rules and deadlines. Enrolling in Medicare. Part D isn't just about signing up. It's about signing up at the right time. Missing key deadlines can cost you both money and access to coverage. Here are the 3 time frames every senior needs to know. Initial enrollment period, IEP. This 7-month window starts 3 months before your 65th birthday and ends 3 months after. Enroll during this time to avoid late penalties and ensure continuous coverage. Annual election period, AEP, from October 15th to December 7th. Each year, you can review your current plan, switch to a new one, or enroll if you missed your first chance. Late enrollment penalty if you go without Part D or other creditable drug coverage. For 63 days or more, you'll likely pay a permanent monthly penalty on top of your premiums. And yes, that penalty increases the longer you wait. Don't go anywhere. Next, we're breaking down what you can expect to pay for Part D in 2025, including important projected cost changes. Medicare Part D costs in 2025, projected. Now let's talk numbers, because understanding what you'll pay out of pocket is key to choosing the right plan. Here's what the projected costs for 2025 look like. Monthly premiums expect to pay between $35 to $45 per month, though exact costs depend on your plan, location, and insurer. Annual deductible, the maximum deductible, is expected to rise to around $590. Some plans may offer a lower deductible, but usually with a higher premium. Copays and co-insurance. Your share of the cost depends on formulary tiers. Generic drugs cost less, while brand name and specialty drugs cost more. Be sure to check if your medications are covered and at what tier. IRM-AA, income-related monthly adjustment amount. If you earn above a certain income level, you'll pay an extra surcharge on top of your monthly premium. This can range from a few dollars to over $70 depending on your income bracket. Tip: reviewing your income from 2 years ago helps predict if you'll be subject to IRMAA. Coming up next, we'll explain the donut hole coverage gap and what changes are happening in 2025 that may affect how much you pay at the pharmacy. Stick around. The 2025 donut hole coverage gap. Now let's talk about something many Medicare beneficiaries hear about, but few truly understand: the donut hole, also known as the coverage gap. In 2025, you'll enter the donut hole once your total drug costs, what you and your plan spend together, reach $5,030. Here's what that means for your wallet. While in the donut hole, you'll pay 25% of the cost for both generic and brand name medications. This can add up quickly if you rely on several prescriptions or high-cost drugs. But there is a light at the end of the tunnel. Once your out-of-pocket costs hit $8,000, you'll transition into catastrophic coverage, where your cost sharing dramatically decreases. We're just getting started. Next up, I'll walk you through important changes to Medicare Part D in 2025 that every senior should know. Don't click away yet. Key changes to Medicare. Part D in 2025. There are some important reforms coming in 2025 that aim to make prescription drug coverage more affordable and more transparent for seniors. Here's what's changing. Out-of-pocket spending cap. One of the biggest improvements is a $2,000 annual cap on out-of-pocket drug spending. Once you reach that limit, you won't pay any more for covered drugs that year. That's a huge relief for seniors managing chronic conditions or high-cost treatments. More $0 deductible options. You'll see more plans offering $0 deductibles for Tier 1 and Tier 2 generic drugs, which means lower upfront costs and simpler budgeting. Insulin and vaccines. The Insulin Savings Program continues to expand, capping most insulin costs at $35 per month. Plus, many vaccines, including shingles and flu shots, are now covered at no cost to you under all Part D plans. These changes reflect Medicare's commitment to promoting smart aging and financial protection for our senior community. Up next, I'll share some powerful practical tips you can use right now to save money on your prescriptions. Stick around. You don't want to miss these. Tips to save on Medicare. Part D. Let's wrap up this segment with something I always stress to my clients. Smart choices lead to real savings. Here are some trusted strategies to help you reduce your prescription costs under Medicare Part D. Use Medicare's Plan Finder tool. It's easy to overlook, but the Medicare.gov Plan Finder lets you compare plans based on your current medications, preferred pharmacy, and zip code. Many seniors find savings of hundreds of dollars per year just by switching to a more suitable plan. Preferred pharmacy networks. Some plans offer lower copays when you use pharmacies in their preferred network. Be sure to check if your pharmacy is included. You could pay significantly less for the same prescription. Ask your doctor about generics. Don't be shy. Ask your doctor if a lower-cost generic can work just as well as a brand-name drug. Many do, and can save you a great deal. Apply for extra help, low-income subsidy. If you're on a fixed income, you may qualify for extra help, a federal program that lowers premiums, deductibles, and copays. Millions of seniors qualify, but many don't know it. Video coming up next. We'll go over how to identify hidden gaps in coverage and how to avoid the most common Medicare Part D mistakes. Make sure you stay with us. Your health and your wallet will thank you. Conclusion and final tips. Let's take a moment to step back and reflect. I know Medicare Part D can feel complex, even overwhelming at times. But here's the good news. When you understand the basics and stay informed about the changes coming in 2025, you're no longer reacting to rising drug costs. You're taking control. And that control can save you hundreds, if not thousands of dollars each year. One of the biggest mistakes I see? People auto-renew their plan every fall without taking a closer look. Remember, formularies change, premiums adjust, and new plans may offer better coverage for the medications you rely on most. So take the time to review, compare, ask questions. And if you're ever unsure, don't hesitate to reach out to a licensed Medicare advisor you trust. You deserve a plan that works as hard for your health as you do. If this video helped bring you some clarity and confidence about Medicare Part D, please take a moment to like, share, and subscribe. You never know, it might just help someone else avoid costly mistakes and protect their health in 2025. Thank you for watching, and I'll see you in the next video, because smart aging starts with smart choices.